So thank you, doctor. You've explained that bipolar illness is a prevalence of 1 to 2%, that in bipolar we don't have any particular predispositions according to sex or to geographic region or ethnicity. What about age? Are there particular age groups that are more likely to develop or show a first episode of bipolar illness? And what should our viewers be thinking about regarding that?
I think that's a very important question, and I think the first episode of bipolar disorder is typically in late adolescence, late high school, early college, but sometimes it can be in the 20s or 30s. And the first episode can sometimes be a severe depression, so that the physician and the family might not know that this is bipolar. It might look like a unipolar depression. And sometimes no one knows, but if there is a family history of bipolar disorder, a unipolar depression should be suspected of being bipolar, and that affects the treatment. Also, if an early depression is extremely severe and doesn't seem to have any causes, any environmental triggers, I think the physician and the family should suspect that this might be bipolar disorder. Childhood bipolar disorder occurs, but it's relatively rare, according to most experts. Sometimes childhood bipolar disorder can be confused with the much more prevalent hyperactivity and attention deficit disorder of childhood, and that will require an expert to make the differential diagnosis. But family history is also important there. There are some people who late in life have a brain disease like Alzheimer's or a stroke and develop bipolar disorder secondary to the brain damage caused by another clearly organic brain disorder. And this strengthens the belief that bipolar disorder is based on a biochemical disorder of the brain, because we see such similar disorders sometimes after a neurological problem or in people who are predisposed after amphetamine abuse or after medical need for steroids. And so we think that probably even in those cases where there isn't drug abuse, that there's some kind of biochemical abnormality that predisposes a person to lose control of the normal variation that we all have in our moods.
So interesting. So you had spoken before about what causes bipolar and how it seems to be probably a 50% genetic thing, and then there were certain environmental factors, and you mentioned drug abuse as one of them. Are there particular drugs that people should be most concerned about? I mean, stimulants make sense, amphetamines and cocaine and things like that, but would that also include alcohol or marijuana or opioids, which tend to be depressants? Are those also likely to trigger bipolar illness?
I think those are less likely. It is important in high-dose steroid treatment, even when prescribed by a doctor, to know that this can sometimes trigger a bipolar predisposition. I think it's also important for all of us, both physicians and the public and patients, to know that sometimes bipolar disorder has no obvious cause, and that it happens with no triggers, no drug abuse, and no family history. And so that no one should be always assumed in any way to be guilty for his bipolar disorder.
So you're saying sometimes it just happens.
That's right, that's right. And of course, when it's family history, it's no one's fault as well, because we inherit the good things and the risk factors from our parents, and we have to take the good along with the bad.
Yeah, like you said before. Yeah.